Hi there, you can go ahead and take a seat. All right, I'm just gonna be writing some notes here. So what brings you in today? Okay. All right, so you've been having some issues with your ears. Can you tell me a little bit more about that? Okay, so your ears feel a bit clogged. All right, how long has this been going on for? Okay. Is it in both of your ears or only one? Okay. Do you feel any pain in your ears? Okay. Any like irritation when you touch, or is it just happens? Okay. Have you noticed any changes in your hearing? Okay. All right. I think that is it. I just want to verify your name and your birth date. So, can you tell me your name and spell it for me? Okay. Perfect. And your date of birth? Okay. All right, so we can go ahead and get started. I'm just going to examine your ears first, and then we'll find a solution to what's going on. Just gonna put some gloves on. Okay, so you are feeling some pain. Very interesting. So you said it's not when I touch, but it's only when it's just like random, right? Okay, well, we're just gonna double check that. I'm gonna be touching your ears as well, if that's okay. Okay, I have this light here, and I'm just gonna be looking at both of your ears and gently touching. So just stay still. Are you feeling any pain? I'm doing very gentle touches. Okay. All right, no pain on that side. Let me just check the other side. Very gentle touches. So if you feel any pain or discomfort, let me know right away. Okay, anything? Okay. Interesting. So no discomfort there. I'm just going to cup your ears now, so just squeezing your ears. So let me know if that bothers you. Okay, I'm just gonna do it right now. Did you feel any pain there? Okay. So not much pain or any pain when your ears are being touched. Let me just write that down. Touching ears. Okay, perfect. All right. So have you been using cotton swabs in your ears? Okay. Yeah, sometimes that makes wax like go deep in your ear and compact it. So that could be a reason why your ears are feeling this way. But we are definitely going to check it out. Before I start, I'm just going to be putting this temperature gun in your ears because we want to rule out if you're sick or not, because congestion and being sick can cause your ears to feel that clogged feeling. So I'm just going to first put this in your ear. Okay, let me just check one more time. I'm sorry. Okay. All right. Perfect temperature here. Let me just check your other ear. Okay, so your temperature is good on both ears. Not seeing any issues there, so I don't think it's congestion. I think your ears may be clogged because of earwax being pushed back. I am going to use an otoscope now to look inside your ears to really see what's going on. If you can just relax and just stay still for me. I'm going to be looking at this ear first. Okay. So you do have a lot of compacted wax, but don't worry, we'll be able to clean that out. I'm thinking that's the reason why you feel that clogged sensation and your hearing is a little wonky. But we're going to be looking at your other ear now. So just stay still, okay? Both ears are very compacted with wax. Happens pretty often when you use cotton swabs. What I'm going to do now is just do a quick little hearing test. We just want to make sure that your hearing does improve after we are done cleaning your ears. I have this tuning fork. I need you to just let me know when the sound stops. Okay, so I'm going to hit this and it's going to make this sound. Okay, so just tell me when it stops. Let's begin. other ear. Very, very good. Okay. Now, I am going to be making the sound with my hands. I want you to tell me how many times you hear that sound, okay? Great. Now let's begin. Okay, how many times did you hear it? 12. Good. Now tell me left or right where you hear the sound, okay? So either left or right. Let's begin. Perfect. Okay. So I do see a little bit of a inconsistency with your hearing from your notes from last year. I think that is because of the clogged ears from the wax buildup. We are going to begin by just taking this here. So this is going to shine a bright light. I can see the wax a little better. Let's see here. Okay, so I'm just going to be scanning your ear with this quickly. Okay, and let me do the other side. Okay, perfect. Now we can begin. I'm going to use a pick here. I'm just going to scrape the earwax out. So you can just stay still and relax. If you feel any pain, don't hesitate to let me know and we'll stop right away. Okay. I'm going to begin with that ear. Just relax. Let me just do the other ear. Sorry. were able to get rid of a majority of the wax, I'm going to just use this tool here and put some liquid inside. So this is going to be like a little vibration, and this here is going to put liquid inside. So we're going to start with the liquid first. So I'm just going to insert some liquid in your ear very gently. Okay, just relax. Good. Okay, now we're going to do the other ear. Okay, now one more time on each ears. One more time. Okay, good. We are going to be using this now. So it's a little vibration. It's supposed to soften that wax that we removed if there's any left. So I'm just going to use it on both ears. Good. Now we're going to do it on the other ear. Perfect. Now, let me just look inside again with the otoscope to make sure that we were able to get the wax out and that there's no redness, irritation like that. It's not going to be 100% wax removal because wax is important to have in your ear. It protects your ear, but you know, too much can sometimes cause that cloggedness that you're feeling. So I just wanted to double check, make sure we took an appropriate amount out and that there's no more of that compacted wax in there, okay? Let me look in this ear. Very good. So for that one, I think that we did really good there. Wasn't seeing much of earwax, no compacted wax. So that's really, really good. Let's look at this ear. See, with that one, everything looked really good. We were able to get rid of all that wax. I'm just going to gently touch your ears now. I just want to make sure that you're not feeling any pain or irritation, okay? We're going to just start with this ear, just lightly touch. No pain? Okay. Now let's see the other one. Okay, both ears look really good now. We are now going to be testing your hearing again. So I have the tuning fork. I'm going to hit it and you're going to tell me when the sound stops. Okay, let's begin. in. Very good. Very good. Let's do it one more time on both ears. Good. Very good. Now we're going to do the same thing with my hands. I'm going to make this sound. I want you to tell me if you hear it on the left or the right. Okay? Let's begin. Perfect. Now I want you to tell me how many times you hear that sound. Let's begin. How many times was that? Good. That was 15. Okay. I'm just going to write some notes down. Okay. So your hearing was very good. I feel like before you had 95% of your hearing when it was compacted. Now it's 100%. You got none of them wrong. But when we did the test before, you did get 2 questions wrong. So it's nice to see the difference between, when your ear was clogged and then not, and to see how well your hearing has improved. But we are going to be sending you home with some eardrops. There can be some irritation just from the ear cleaning, and these eardrops are supposed to help with that irritation feeling and discomfort. It might not happen. You might not feel any discomfort at all, but just in case. But if you're not feeling any discomfort, you don't have to use it. But if you are, definitely use it. And if you still feel pain after about 3 to 4 days, you should definitely come and get another exam so we can make sure that we rule out everything. Okay, but from what I'm looking at now with the otoscope, it's looking like everything is perfect. Like I wasn't really seeing any redness, so I don't think you will feel any pain. Okay. Yeah. So I think the eardrops are just like a last resort just in case. But yeah, I don't think you're going to feel any pain at all. But that was the end of our ear exam today. You did fantastic. Everything looks really, really good. Your hearing has improved after we were able to remove the compacted wax. And like I said, we're going to be sending you home with some eardrops. But it was very, very lovely to meet you. And I hope you have a lovely rest of your evening, okay? All right, I'll see you around. Bye-bye. Hi there, you're here for the eye scan and vision test, correct? Good. All right, I'm just gonna start by putting on my gloves, and we'll examine your eyes right away. So So, have you had any changes in your vision recently? Okay, interesting. I'm just going to start off with just a light here, and I'm going to be looking deep into your eyes. I just want you to keep your eyes open for this portion. So just look at my nose. Good. And just keep looking at my nose. All right, can you look up for me? Good. Can you look down? Can you look left? And can you look right? Beautiful. Now, same thing, just try to keep your eyes open for this portion. And just look at my nose. Just looking at the other eye. Very good. Okay. Can you look up for me? Good. Can you look down? Can you look left? And can you look right? Perfect. Yeah, your eyes look good. I'm not seeing any redness. I'm going to take a different light now. This one's supposed to be a bit brighter, but it's a little light. I just want you to follow the light. Okay. Yeah, just follow with your eyes, don't follow with your head. Very good. Now I just want you to look at my nose. I want you to tell me when you see the light enter your vision. Good. Good. You're doing great. Okay, look at my nose again and tell me when the light leaves your vision. Very good. Okay, we are all done with that light. I'm just going to start with getting your temperature quickly. So just relax. It's just going to go on your forehead. Okay. Good temperature. I just want to make sure you're not sick before we begin. Okay. So I am going to be doing some eye scans on you like we mentioned before. Let me just take our first eye scan tool. So this here, I need you to just look at my nose. Okay. All right. Now let's begin. So we just have a red color. Okay, so just look at where my nose should be. You know, the lights end up blocking it. Just keep looking at my nose, okay? We're just gonna keep scanning your eyes. Okay. Just scanning. Okay. We're gonna change the color. Okay. Now there's a little vibration. Okay. So it should be kind of warm for you. Good. Very good. Okay, now we have blue. Okay. Now we have red and blue. Just gonna keep scanning your eyes. Very good. Now we're just going to end with the red again. Perfect. Okay. Now we have have some more scanning tools, but we won't be doing those later. I'm just going to check out your eyes here. So I'm just going to put this on your face. Okay. Tell me when you see the light. Good. Your other eye. Okay, tell me when you see the little baby lights like this. Okay? Good. 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 Alright, let's move on to the other eye. Okay. Tell me when you see the little lights. Oh. The flashlight just died. Okay, but you did really good. That was perfect. I want you to look at my nose again, and I want you to tell me how many times you see this red light, okay? Just look at my nose. Very good. Okay, I want you to tell me if you see the light on the left or the right, okay? Keep looking at my nose. Mm-hmm. Perfect. Okay. We are going to be looking at your eyes with this red screen. Let me know when the light turns white. So right now it's like an orangey color, right? Okay, tell me when it turns white like that. Okay. Good. Good. Let's switch it. Let's do this side. Yeah. Might be a little tough for me. All right, ready? Good. 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 Oop. Good. 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 Perfect. We are going to be doing a color deficiency test now. What number is this? What number? 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 Do you see a number here? How about here? How about here? And how about here? Good. Do you see a number here? How about here? seen any issues with your color deficiency, so no color blindness here. I'm going to be covering one eye. Tell me how many fingers I'm holding up. Good, good. Good. Over here, tell me how many fingers I'm holding up. Sorry, I'm overthinking it. Very good. Okay. Now I want you to follow my red light with your eye covered. Okay. Just follow it. Just follow the light. Follow the light. Okay, now tell me when it blinks. Good. 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 Okay. Let's do the other eye. So just follow the light. Follow the red light. Okay, tell me when it blinks. Good. 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 Okay. And we're gonna do another scan here too. Just keep your eyes open for me. Okay, just follow the light. Follow the light. Follow the light. Good. Perfect. I'm going to be testing different lenses on you. So, let me know if you can see the letters. Good. Okay, let's do like a different prescription. How's that looking? Okay, interesting. How about here? Okay. And here, it looks better. Okay. And here. Okay, what's the smallest line you can read? Okay. Very good. All right. We're just going to go back and forth between different lenses. So, lens 1 or lens 2. 1 or 2. 1 or 2. Okay. Interesting. Okay, so lens 1 or lens 2. 1 or 2. 1 or 2. 1 or 2. Okay. Lens 1 or 2. Sorry. Lens 1 or 2. So this one's really zoomed in. Okay, let me try this one. lens 1 or lens 2? 1 or 2? 1 or 2? 1 or 2? Okay. Lens 1 or 2? 1 or 2? 1 or 2? 1 or 2? Interesting. Okay, so your prescription has stayed the same. So I'm just going to look at your eyes a little bit deeper with this here. Let me just turn the light on quickly. Okay, so just stay still for me, alright? Just gonna be looking at your eyes. Okay. Good. Okay, I'm just gonna use one light. Just look at my one light here. Very good, very good. Okay, turn that light off. Okay, look at this light here. Let's make it a little less bright. Look at this light here. Very good. Very good. Okay. Just want to get a deeper look at your eyes. I'm gonna just measure your eyes. Good. Just do another scan here. Okay. So this one's kind of like taking a picture. So just look straight. Okay. Just look straight. Beautiful. Okay, that is all for our test today. So we were able to do a vision test and eye scanning on you. Your eyes look very, very healthy, nothing to worry about. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I'll see you around. Bye-bye. Hi there. So you're here today because you hit your head, right? Okay, yeah, I see that your pupils are 2 different sizes. That's something that is kind of consistent with getting hit in the head or, having a concussion. So I'm going to be looking at your eyes. I'm just going to start with a light. Okay, let me know if the light is too bright. Does it hurt your eyes at all? Okay, that's good. Yeah. So how did you hit your head? Okay. Gotcha. Okay, no worries. We'll get to the bottom of it. Make sure that everything's okay. We're going to be doing a cranial nerve exam on you. Just making sure that everything is looking good. So you're saying the light doesn't bother you, right? Yeah, it's not too bright. Okay. Can you just follow the light with your eyes? Mm-hmm. Very good. Very good. Okay. I want to just see the size of your pupil, so I'm just going to measure it. I'm going to measure both of them. Just look at my nose, and if this blocks my nose, just keep looking at the general area of it. Okay, I'm just going to measure. Just want to see how different the pupils look. Okay, get the other one. Okay. Yeah, there is definitely a difference between them. This happens most of the time when people get hit in the head, so I'm going to just take a couple pictures of your eyes before we get started. I just wanted to document that. Okay, so I'm just going to touch your face. Let me know if you feel any pain along your eyes or your cheeks, your forehead. Okay, you can feel my hand touching your face, correct? Okay, good. I'm not seeing any bumps along your head, which is a good sign. Let me just touch around the top of your head. Yeah. Your face looks symmetrical. Like I said, not really seeing anything that is concerning right now. Okay. So, we're going to just keep looking at your eyes now. I'm going to get a bit closer with this. I'm going to see if there's any redness or any red veins. Okay. Just try to not blink. Very good. Can you look up for me? Okay. Can you look down? Now look left and look right. Good. You can blink, 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 blink. All right, I'm looking at your other eye. Can you just keep your eyes open? Okay. Now, can you look up for me? Can you look down? Can you look left? And can you look right? Very good. Okay, so now I just want you to blink, 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 blink. Very good. Okay, can you see this light here? Okay, what color is the light? Good. Can you follow it with your eyes? Very good. You're doing great. Just keep following it with your eyes, not your head. Okay, now follow with your eyes, not your head. Okay. Is the light close to you or is it far away? Okay, how about now? Is it close to you or far away? Good. Okay, how about now? Okay, tell me when it gets far away. Good. Now tell me when it gets really close to you. Very good. I have two different lights now. One's a white color and one's a red color. I want you to follow the red light, okay? Follow the red light. Follow the red light. Good. Now follow the white light. Follow the white light. Very good. Okay. Now you just see the red light. I want you to follow the light. Okay. alters your vision. You're doing great. Perfect. Now I want you to tell me how many fingers I'm holding up. Okay, so we'll get this hand here. Okay, how many fingers am I holding up? Good. Good. Now we're going to do it here. How many fingers am I holding up? Good. All right. I have this sheet here, and there is a bunch of different letters. I want you to read this letter. What letter do you see? Good. Can you read this one? Good. How about this line? Good. Okay. What color do you see here? Okay. And what color is this? Good. Okay. Can you tell me what day it is? Good. Do you know what day of the week it is? Okay. Very good. And when's your birthday? Perfect. Okay. I am going to just check your ears quickly with an otoscope. I just want to make sure that there is no swelling along your head. So sometimes we can see swelling in the ears. So I'm going to take this otoscope in your ears and just check for any swelling. So just relax and stay still. I'm going to do this ear first. Okay. Now let me just look at the other ear. Okay, I'm not seeing any swelling. That's a really good sign. All right. Now we're going to be looking a little bit at your hearing. So I have this tuning fork. I want you to tell me when the sound stops. Very good. Very good. Very good. Very good. All right. Now we're going to do some click sounds. So I want you to tell me when you hear that sound, okay? Let's begin. Very good. Now I'm going to whisper some words in your ears, and I want you to tell me what the words are, so just repeat after me, okay? All right. So first word, sleepy. Good. Sleeping. Good. Dreamy. Okay. Dreams. Strawberry, pineapple, scratch, scratching, Very good. Okay. I'm just going to get the temperature quickly of your ear. Just want to see how you are doing right now. If maybe you're getting a little sick as well. Good temperature. Good temperature. All right. All right. So your hearing looks good. I'm going to use this tool here. So I'm going to be tapping along your face. I want you to tell me when you feel that tap, okay? All right. Stay still for me. Good. Okay, we're going to do the other side. Very good. Okay. Now, we're going to do a different test. So I have two different tools here. So this one blows air like that. So that's how it's going to feel in your face. And this one vibrates. Okay, so I need you to close your eyes and tell me if you feel the air or if you feel the vibration. Okay? Great. Okay, so keep your eyes closed for this one. All right, so do you feel the air or vibration? Let's begin. Okay. Okay. Okay, very, very good. You did great. Okay. We're going to be doing a taste test now. So I want you to just open your mouth. I'm going to put a drop of solution that's going to have different flavors. So let me just get that. All right, so what flavor is this? Good. That was strawberry. Let me get another one here. Ready? Okay. Okay, what was that? Okay, that was coffee. Okay, let's do another one here. Okay, open your mouth. What was that? Okay, that was lavender. Okay, let's do one more here. Okay. And what was that? Good, that was honey. All right, we're gonna do the same thing, but with smells. Okay, so I have this again, this little tool. So same thing, putting a little solution here, but this one is going to spray a different fragrance for you. So let's begin. So I'm just going to spray it near your nose. Okay, what fragrance did you smell? Okay, so you smelled roses, very good. Okay, let's do it again. Let's get a different smell here. Okay, what fragrance do you smell? Okay, strawberry, very good. Let's get another one here. What did that smell like? Good. Coffee. Now let's do one more. Okay. What did that smell like? Chocolate. Very, very good. So now I'm just going to be looking at your throat. So I have this here. Let me get my light. Okay. So just open wide for me. I'm just going to check your throat. Make sure everything looks good. Okay, can you say ah for me? Very good. Okay, everything looks good. All right. Can you follow my finger? Good. Okay. Do you feel dizzy at all? Any headaches recently? Okay. Just want to check your neck area. Do you feel like you're off balance at all? Okay. Just kind of look here. Side of your neck. And over here. Okay, so you feel balance. Okay. I'm going to be touching different parts of your face, and I want you to tell me where I'm touching, okay? Where am I touching? Where am I touching? Where am I touching? Here. Very good. Okay, I want you to smile for me. Smile. Okay, I want you to frown. Okay. I want you to smile with your teeth now. Good. Now move your head to the right and move your head to the left. Good. I want you to put both your arms out like this. I'm going to push down your arm. Okay, try to keep it up. Good. Keep it up for me. Very good. Okay, so already I can see that your pupils are getting a little bit better just over time, you staying awake and us talking to one another. So your pupils are looking better. You're saying you're not dizzy, you don't have any headaches. That's really good. Okay. I'm just going to cover one eye and just examine this eye. Okay. Very good. Okay. Other eye now. Doing very good. Okay, so what I've seen so far from our cranial nerve exam is that you got a concussion from hitting your head. Everything's looking good. I can see your pupil finally getting back to normal. Both of them look about the same size now. We're gonna keep you over tonight. We just want to make sure that everything is good, so you can stay the night, and we'll just be observing you throughout the day. Okay, just want to make sure that everything looks good, and you could probably just go home in the morning. Okay, so you can now rest. You can close your eyes and go to sleep. Okay, everything looks good. Just want to make sure and monitor you for the rest of the night, okay? All right, so it was lovely to meet you, and I hope you have a great rest of your night, okay? All right, bye-bye. Hi, welcome in. Today we're doing an otoscope only ear exam on you, right? Gotcha. Okay, so we'll get started right away. So, this is the otoscope. It has a light at the very end of this tip, and this will be going inside your ear. We'll be looking all around. Is there any reason why you want to get this done today? Okay, so just a general checkup. Gotcha. Okay, so have you felt any pain, discomfort, or irritation at all on either of your ears? Okay. How about hearing? Has your hearing, does it seem like it's gotten worse recently? Okay, gotcha. All right, well, we can get started and look in your ears right away. I will be putting this otoscope in this ear, then this ear, then back and forth, back and forth. So all you have to do is just relax and stay still. You can even close your eyes if you want. Some people say that this appointment is very relaxing. But yes, let's begin. So like I said, we're gonna go back and forth, back and forth, okay? All right, let's get started. we are now all done with your otoscope only ear exam. You did really, really good. You stayed still. You were very relaxed. Inside your ears looked really, really good. I didn't see any wax buildup, any redness. You didn't look like you were in any pain. If anything, you looked very relaxed, like I said. But yeah, that was the end of our otoscope only ear exam today. Thank you so much for coming in, and I hope you have a lovely rest of your evening, okay? All right, I'll see you around. Bye. Hi there. Today I'm going to be doing a super detailed eye exam on you. Just going to use my light, and I just want to see how your eyes react to the light. So just keep looking at my nose. Good. Very good. Nice. Okay. Does the light feel kind of bright for you? Okay. Very good. Okay. How about if I get it closer? How does the light feel? Is it too bright? Okay. How about on the other side? Okay. Very good. Can you follow my light? Just with your eyes. Good. Very good. Can you tell me when the light enters your vision? But you have to keep looking at my nose. Okay, let's begin. Very good. Okay, tell me when the light leaves your vision, and you have to keep looking at my nose. Okay, let's start here. Okay. Good. 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 Okay, we're gonna do the same thing, but I have this red light, and I want you to tell me when you see it blink like that through your peripheral vision. So you need to keep looking at my nose. All right, so just tell me when you see that red light. Good. Very good. Okay. Very, very good. You did great there. All right. Now I'm just going to cover one eye. Good. Now look at my hand. All right. Now tell me how many fingers I'm holding up, okay? Good. Very good. Good. Now let's do the other hand, or the other eye with my other hand. Ready? Okay. Good. Now let's do it with both of your eyes, okay? So let's try here. Ready? Oh. Okay, let's try over here. Okay. Good. Okay, now let's try with the light, okay? So I'm gonna have the light here, and I want you to look at my hand, okay? Okay, ready? Okay, now let's try this side with the light. Ready? Okay, now I just want you to follow my instructions. So I want you to look at my light. Okay, now look at my nose and my finger. Okay, now look at my light. Now my finger. Look at my nose, the light, my nose, my finger. Look at my nose, my finger, the light, and my finger, and the light. Look at my nose, my finger. Okay. The light, my finger, and my nose. Very good. I'm just going to take a look at your eyes with this tool here. So just keep your eyes open. I'm just going to get kind of close to you. All right, so just keep your eyes open. All right, look up for me, please. Okay, now look right. Okay, now I need you to look down, left. Good. Okay, let's look at this eye. Okay. I need you to look up for me. Okay, now look down. Can you look right? And look left. Good. Okay. Now I need you to follow this light quickly. Okay. Very good. Okay. So I just want to test something quickly. So I have this tool that blows air. I'm going to be putting it really close to your eyes, and it's going to blow air in your eye. I just want to see how your eye reacts to it. So you have to keep your eyes open. Don't blink, okay? Just keep it open. Don't blink. Okay, ready? Good. Okay, we're going to do the same thing on this eye. Okay, so don't blink. Good. Let's do it one more time. All right. Keep your eyes open. Don't blink. Good. It's right here again. Keep your eyes open. Don't blink. Perfect. Okay. I am just going to put on some gloves here. I am going to be touching your eyes, just seeing if there's anything going on. So like any bumps, lumps, anything like that. So just relax. Do you feel any pain when I touch your eyes? Okay, interesting. Okay. Very good. Okay, I don't think I need my gloves for anything else. I'm just going to take them off now. I have this light here, it's a little different. Okay, so it's a red light. I want you to follow the red light. Okay, good. Very good. Very good. Very good. Very good. Okay. Tell me when the red light enters your vision. Good. Great. We're going to keep using the red light, so I'm just going to put this tool over your eyes. Okay. Let me know when you see the red light. So it's covering your eyes, and there's these little dots that can see these red dots, these red lights. So let me know when you see it like that, okay? All right. Good. Okay, let's do the other eye. Perfect. So, this one's a kind of a different test. So, I have this red little screen here, and I have this. So I'm just gonna power it on. Okay, so let me know when you can see the light exit this red screen. Okay? Alright, let's begin. Oh. One moment. There you go. Okay, so you want to kind of see like a blue light. Alright, let's begin. Okay. Good. Right. All right. Very good. You did perfect. All right. Now, I'm just going to check your vision. I'm going to put this pretty close to your face. All right. So, I just want you to read the letters out to me. Okay. So, let's start with this letter right here. Good. Good. Mm-hmm. Okay. Now that we did those, I'm just going to cover your eye, and I want you to read the smallest letter that you can, the smallest row that you can, okay? All right. So here you go. All right. Yep, go ahead. Perfect. Okay, let's do the other side. Right? This one's just a bit blurrier. Interesting. Okay, so that one's a little bit harder to read. Yeah, that's pretty consistent with what your prescription was before. So, pretty normal that that's happening. Okay, let's see. I'm just going to take this measuring tool and I want to measure your eyes so we can see. Let's see. It's like, oh, kind of a ruler. Like that. So I'm just gonna kind of see where your eyes are at so we can just try a prescription of glasses to see if that kind of helps when you're reading the letters to me. So measure your PD quickly just to make sure we get the right glasses for you. Just want to double check that you still have the correct prescription. Okay, let's see. All right. Interesting. Okay. So I have some glasses for you. Let's put them on. I'm gonna cover your eyes and I want you to read the smallest line you can again, okay? One moment. Let's do this eye first, okay? All right. Read the smallest line. Very good. Same thing with this eye. Just read the smallest line. Okay, so it does look better. Very good. Let's read the smallest line. Perfect. Okay, so it looks like your prescription stayed the same. So nothing to worry about there. But I need you to keep those glasses on. We're going to do a color deficiency test. So, what is the number in the circle? Here, 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 and 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 here, trace your finger all the way across from X to the other X, okay? Alright, let's begin. So start here. Good. Very good. Now, let's take off those glasses for you. Great. Okay. So those glasses felt pretty good, right? Yeah. So, I'm assuming your prescription is the same. I'm just going to end this examination just testing your sensitivity again. So I'm just going to put some gloves on. Sorry, I should have did this one earlier. So I have this little hammer and I'm just going to press it against your eyes. You can close your eyes for me. And then I have this tool here. So I'm just going to spray some liquid, just very gentle. Okay. Yeah, it's just like very tiny drops. Let's do the other side. Perfect. Okay. Yeah, everything looks good. Let me just wipe off that liquid. Okay. So everything looked really, really good. I didn't see any issues with your eyes. Your prescription stayed the same. Everything looks fantastic. But yeah, that's the end of the eye exam today. Thank you so much for letting me examine you. You're an amazing patient. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, bye-bye. Hi, welcome in. It seems like you're really late for your appointment, but that's okay because sometimes we have late night appointments where you can close your eyes and relax. So that's what we're going to be doing today. And we are going to be looking at your eyes and your ears and just your overall health today. Okay, so all you need to do is lay down and relax and we'll get started. Alright, what I'm going to do first is just get your temperature. I have this temperature gun that goes on your forehead and I'm just going to do that now. Good. One more time. Okay. Very good. Your temperature is great. I'm just going to double check with this temperature gun that goes in your ear. Alright, just stay still for me. Just wait for the beep. Temp here. Let me just check your other ear quickly. Okay, fantastic. Your temperature is great. And now I'm just going to a look at your face. Like I said, you could just close your eyes. I'm going to be using a light. I'm just going to be touching your face, just observing, seeing if there's any bumps. Okay. I'm going to be asking you some questions, but if you end up falling asleep, which happens pretty commonly here, if you fall asleep, it's totally okay. We'll just keep asking questions, and if you wake up and you can answer them, that's totally fine. But does it hurt when I touch your face? Okay, that's good. Okay. I'm going to be touching your ears very gently. Let me know if you feel any pain. No pain? Good. Let me try the other one. Any pain? Good. Okay, I'm going to be looking at your eyes now that they're closed. I'm going to see your lash line. Okay. Can you see the light through your closed eyes? Okay. Let me look at the other one. You have really pretty long lashes. Checking. Can you see on this side the light through your closed eyes? Okay. Now, can you open wide for me? I'm just gonna get this little mirror and check inside your mouth. Okay, just open wide for me. Very good. Okay. I'm not seeing any redness in your throat. Your teeth look very good. I'm not seeing any cavities. I'm not seeing plaque. Okay, very good. I'm gonna just take a closer look at your eyes with this tool here. I know your eyes are closed. I just really want to see the skin, your lashes. Looks really good. Now I'm just going to be touching along your neck here. Pretty good. Any pain where I'm touching? Okay, good. Okay. Now I'm going to be looking inside your ear with an otoscope. An otoscope is just a tool that I can see inside your ear with. So I'm just replacing the top of my last tool that I was able to see with your eyes. And now I'm putting the otoscope top on. Now I need to get able to find one. So I'm just going to put the top on, and I'm just going to put this otoscope in this ear right here. Okay. So just stay still. I'm going to be just checking, make sure everything's good in there for wax buildup or anything that's concerning, any redness. Okay. All right, let's begin. Let's look at the other ear here. So I did see a little bit of wax buildup, but don't worry, we can get rid of that. I have this tool here. It blows air inside your ear, so we're going to be doing that to get rid of the initial wax. Let's do the other ear. Great. So that softened the wax. Now we're going to go in with a very gentle pick, and I'm going to scrape off that earwax. Just relax. Good. Now let's look at the other ear and remove that wax. Perfect. Now let me just go in with the otoscope one more time. Good. check one more time on this side. Alright, both sides look really, really good. I'm just going to do one more blow on each side with this tool. Good. One more time on the other side. Fantastic. I'm just going to do a hearing test now. Let me know when you hear a click sound. Very good. Now, let me know when you hear a beep sound. Okay, perfect. Now I'm going to use a tuning fork that makes that sound. I want you to tell me when the sound stops. Okay, let's begin. Good. 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 Very good. Okay. I'm just going to take this measuring tool here. I'm going to be measuring your ears. So I know your eyes are closed, but it's just like a super clear ruler. Okay, so just gonna do it with your eyes as well. Good. I'm going to measure your eyes. Just the distance between your eyes. Keep your eyes closed. One moment. Let me see. Got my flashlight here. Just measuring your eyes. Okay, very good. I'm gonna take one more measuring tool. Measure your face, your ears. Very good. I'm going to be now hitting your face with a hammer just to see how sensitive your face is. So just relax for me. Okay, did that hurt at all? Okay, now let's do the other side. Okay. Perfect. Doesn't seem like you have any issues there. That is it for our exams today. Everything looked really good. You can keep your eyes closed. You can stay here for the night if you want to keep sleeping, if you are asleep. But I just want to say thank you so much for letting me examine you. And I hope you have a lovely rest of your evening. Okay? Alright, I'll see you around. Bye-bye. Hi there, welcome in. So you are here for your glasses appointment, is that correct? Okay, great. So these are new glasses, so you've had glasses before? Okay. So I'm just going to start off by taking a look at your eyes, just making sure that everything is okay. All you have to do is look at my nose right now. Very good. You have very beautiful eyes. Okay. I'm just gonna get a bit closer and I'm going to lift up your eyelids. All you need to do is listen to my instructions, okay? So I need you to look up for me. Okay, good. Now look down. Look left. Now look right. Beautiful. Now we're going to do the same thing on the other side. I'm just going to lift up your eyelids. Great. Okay. I want you to look up for me. Good. Look down. Look left. And now look right. Perfect. Okay. Your eyes look good. Nothing concerning there. Okay. So now I'm going to take my other light. I want you to look at my nose and just tell me when you see the light enter your vision. So we're just going to be checking your peripheral vision right now, okay? All right, so just let me know when you see the light. Keep looking at my nose. Good. Very good. Very good. Okay, we're going to do the same thing, just with a different color light. Just keep looking at my nose. Whenever you see the light. follow this light? Very good. Just keep following the light. Just keep following the light. Fantastic. You're doing really good. Okay, now we're going to do the same thing, but with this light. So I need you to just follow this light. This one's a little bit brighter. So after we've done all these tests so far, do you feel like the light hurts your eyes at all? Okay, that's good. Very good. Okay, now I want you to just look at the light. Just look at the light. Good. Okay, now I want you to look at my nose. Okay, now look at the light. Okay, look at my finger. Good. My nose. Now my fingers. The light. Look at my nose. The light. My fingers. My nose. The light. My fingers. Good. I'm gonna cover one eye now, and I want you to tell me how many times you see the red light. Okay, let's begin. Good. Other eye. How many times? Very good. Okay. So we're going to move on to a couple more tests, and then we'll start with your glasses. So we're just going to do a color blindness test now. I want you to tell me what number you see, and let's begin. What number is that? Good. What number? 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 Okay. What number? What number? Very good. Now I want you to place your finger right here, and I want you to trace the line. Okay? Trace the line. Ready? Okay. Good. Very good. Great. Okay. We are all done with the color deficiency test. You did amazing. No problems there. Okay. Now, I'm just going to cover one of your eyes. All right. Tell me, what is the tiniest line you can see? Okay. No, so it looks pretty blurry. Interesting. Okay, let's do the other side. So read the smallest line. Okay, so it's also pretty blurry for you. Interesting. How about when we don't cover your eye? So I have this here, and I want you to read this letter. Good. This one. Perfect. Mm-hmm. Good. Oops, sorry. Good. Okay, so these two are going to be pretty tough, okay? Take your time, all right? Good, now let's do this last line. This one's going to be tough, okay? Very good. Now I'm going to be checking your eyeglass prescription. I'm going to give you a couple lenses. You're going to tell me which lens is better. So we're just going to see if your prescription has changed at all since the last time you're here. All right, we're going to start off with kind of a lower prescription here. So we have this, okay? So can you see any different with this lens? Okay, it's like about the same. Gotcha. All right, let me just go and check this one, okay? Then we'll do this lens. All right, so lens 1 or lens 2. So 1 or 2. 1 or 2. Lens 1. Okay. So now let's do lens 1 or 2. 1 or 2. 1 again. Okay. Now lens 1 or lens 2. Lens 1 or lens 2. Okay. Let's see here. Lens 1 or lens 2. 1 or 2. 1 or 2. Okay. Just wanna check. Okay. I'm just going to cover one of your eyes here. Okay. How does that look on the side? Any different? Kind of blurry. Okay. What about with this lens? Is this any better? It's a little better. Okay, how about with this one? Okay, good. Let's try this other eye. Okay, how's this lens? Okay. I'll try this one. Okay. Let's try this one. Okay. Gotcha. Just wanted to see if there was any difference between the two eyes before we continue. We're gonna try this one, and we're gonna try this one. Okay. Lens 1. What does it look like? Very, very blurry. Okay, how about this one? Okay, so this one's also like zoomed in as well. Interesting. Let's see here. How about this one? Yeah, kind of zoomed in. And this one? Interesting. Okay. Okay, so lens 1 or lens 2. 1 or 2. 1 or 2. Okay. Okay, now I'm just going to these 2. Okay. Lens 1 or lens 2. 1. Sorry, actually, this is 1 or 2. 1 or 2. Okay. Take a look at these two together. Okay, what does that do? So it looks a little stretched, right? Okay, and there. And there. Okay. Let's see this. So I'm going to take this one. Okay, so one of the zoomed ones. Okay, tell me what happens with this. Okay, interesting. Okay, so what I'm looking at here, just putting this back. If it fits, what the heck? Okay, so what I'm looking at here is this is your prescription. Okay, so it has gotten a little weaker, your eyes, so we had to go a little bit stronger. Not a big deal, happens quite often, especially with me. I wear contacts and glasses. My prescription changes all the time. So now I'm going to measure your face, your PD around your eyes, and we're going to pick out some glasses for you. So we're going to start off with your PD. So I have this tool right here. I just need you to look at my nose, and then we can begin. Okay, just look at my nose, and if this blocks my nose, just try to picture where my nose would be, okay? Just keep looking there. I'm just going to measure. So my nose should be around this area, so just keep looking there. Okay. Okay. So I'm just measuring the distance between your pupils so that when we get the glasses, we can add that number. And it's very important because then you kind of see a little wonky if we get the wrong number. So just keep looking at my nose. You can blink as many times as you need. Okay. Let's see. It's looking like 35. Yeah. So it hasn't changed since last year. It doesn't necessarily change all that much. That's good that we're able to get that. Now I'm going to measure your eyes here. Okay, just keep looking straight at me. Try not to move. Okay. Now we're going to measure one more time with this tool. Now, since we were able to do that, I do have some glasses that are ready with the same prescription, same PD, all of that. So you just need to try them on. So first off, we have these here. Let me just clean the lens quickly. So these kind of give that like Ray-Ban feel. This is what they look like. Just black. They have like two little dots right here. So let's just put them on you. Okay. So how's that? Okay, yeah. They look really nice. Take them off now. I have a couple more pairs. So we have these. They're like a pinkish purple with gold right here, and yeah, they're really cute. A little bit different. This is a lot thinner, and they have kind of like a cat eye at the end, just a little bit. So let's try them on you. Okay, what do you think? Yeah, they're really cute. Yeah, I really like them too. Do they fit well? Okay. All right, let's just take those off. Good. Okay, we have two more for you. So, actually, we have three more. So this one's kind of unique. This is one of our newer ones. It has this little silver half circle at the nose, and it's really pretty thick right here, a little bit thicker than the last pair we had. So it's kind of giving the vibe of the first one, just a little different right here. Let's try these on you. What are you thinking? I honestly think they look really good. Very unique, a very different style than the rest of them, especially with that little circle there, half circle there. Yeah, they're really cute. Let's take them off you. Good. Okay. Now, this one is a bit different than the rest. So let me just clean the lens for you quickly. So these are a really pretty, like rose gold, very thin around here, but I think that's pretty much the style that they're going for. Even though they're thin, they're pretty sturdy. These are really, really cute. Over here, they have a little bit of like a plastic cover, so that's not like irritating your ears when you have them on. Yeah, let's put them on you. What do you think of these? Yeah, they're super unique. They're really beautiful. I think they're really cute. I love that rose gold pinkish color. I think they're adorable. Yeah. Do they fit good? Okay. Nice. Okay, so we have one more pair. So these ones might be my favorite. So they're honestly like pretty thick, and they honestly look really nice. I have this pair at home. They also have those two little dots here, just like those first glasses we tried on. But these, I don't know, I really like how thick they are here. They give, they're really like sturdy, thick right here as well. So, yeah, these are from Diff Eyewear, it says. And they're Weston BK6762. Yeah, they're really, really cute. So let's just try them on you. Okay, very good. Alright, what are you thinking? Yeah, for the bigger glasses, it's kind of nice because it fills up like the whole area, so you're not getting like half of your eyesight cut off. Like sometimes I have trouble with glasses that are a little smaller. Yeah, they're really cute on you. You look amazing with those. Mm-hmm. All right, let's take these off. Perfect. Okay. Yeah, those are the glasses that we have available in your prescription, in your PD measurements, all of that. So you could go home with these, or you can just wait and look at different styles and we can put in an order for you. Okay, so yeah, they were all very, very nice, and I can see why you're having trouble picking one. Which one do I think you should get? Honestly, I think the last one was definitely your style. These are really, really cute. I think these are the ones for you. Yeah, you could definitely take them home today. They're ready. They are perfect fit for you. Perfect prescription as well. So you can go ahead and go home with these today. Okay, so that's what you want to do? Alright, yeah, definitely we can do that for sure. And thankfully your insurance covers it 100%, so we won't need a payment for you today. Yeah, so today we're going to be sending you home with your prescription, your updated one, just like a form. So if you want to shop around and get glasses online, you can do that as well. And I think that is about it. There were no issues with your eyes. You looked really, really good. Not concerned about anything. And we will be sending you home with the glasses. Alright? Yes. But it was very lovely to meet you, and I hope you have a lovely rest of your evening. Alright? Okay, I'll see you next year. Okay, bye-bye. Hi there, you can come take a seat. So you're here for a yearly doctor's appointment, correct? Okay, well, we can get started right away. I'm just going to get your temperature. So this temperature gun goes on your forehead and your cheeks. So just stay still. Good. Now one more time. Okay, good temperature there. I'm just going to check your ears as well. So this is a different temperature gun that goes inside your ears. So just stay still. Okay. Good. Now I'm going to do the other ear. Okay. All right, very good temperature, no concerns there. And let me see, I'm just going to take this otoscope and look in both of your ears quickly. So just stay still. Very good. Let me look at your other ear here. So your ears look good as well. Do you have any concerns going into this appointment? Okay, so just a yearly. Gotcha. I have this measuring tape. I'm just going to measure you. Okay. Very good. So looking at your file, you grew an inch. Now I'm going to just listen to your heart. Okay. Okay, so I have this here. I'm gonna put this on your heart, and I just want you to breathe normally for me. Very good. Just keep breathing normally. Now I want you to take 3 deep breaths, okay? All right, let's begin. Let's do the first one. Very good. Let's do the second one now. Very good. Now let's do the third one. Perfect. Okay, now I'm just gonna go up behind you with it, okay? Now I want you to breathe normally. I'm gonna be listening to your heart and your lungs now. Okay, keep breathing normally. Okay, now I want you to do 3 deep breaths again, okay? All right, let's do the first one. Okay, very good. Now let's do the second one. Very good. Now let's do the third one. Very good. Okay, so your heart and your lungs sound fantastic. Very good. I'm just going to check your eyes now. Okay, so I'm just replacing the top of this. Okay, just turn it on. Right, just look forward for me. Try not to blink. Good. Same thing. Just look forward and try not to blink. Very good. I'm going to look back at that first eye. So, can you look up for me? Good. Can you look left? Can you look right? And can you look down? Perfect. Let me look at this eye now. Okay. Can you look up for me? Can you look right? Can you look left? And no. Can you look down? Beautiful. Okay. Now, is the light too bright for you? Is it bothering your eyes at all? Okay. Can you just look at my nose and let me know when the light enters your vision? So we're going to be checking your peripheral vision now. So just tell me when it enters your vision. Good. Mm-hmm. Mm-hmm. Good. Mm-hmm. Okay. Perfect. Now, just keep looking at my nose. Let me know when the light leaves your vision, okay? Good. 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 Very good. So I have this red light here. So I'm gonna put it around your vision like this. I want you to tell me if it's up, down, left, or right. Okay. Need to look at my nose. All right. Perfect. All right. I'm going to be covering one of your eyes, and I want you to read the smallest line that you can read. Okay? Very good. All right. Into the other eye. Okay. So what is the smallest line you can read? Okay, very good. Now we're going to do it with both of your eyes. Okay. Can you read this line for me? Very good. Can you read this line? Good. Now we're going to really try to read that bottom line, okay? Just do your best. Okay, good try. Can you tell me the two colors here? Good. Okay, I'm just going to take this paper. So right here, it's a measurement of your pupils. So I'm just going to compare your pupils to this. So just open your eyes wide. I'm going to see which one matches. Okay. Just want to measure your pupils with this. Good. Okay. We're going to do one more thing with your pupils. I'm just going to be measuring your pupils. Okay. All right. Okay. Very good. Just measuring the distance between your pupils. Okay, so now I'm going to cover your eye again. Can you see my hand here? Good. I want you to tell me how many fingers I'm holding up. Perfect. Okay, how many fingers I'm holding up? Good. Same thing here, covering your eye. I want you to tell me when you see the red light blink. let's do this other eye. Same thing. Tell me when the red light blinks. Perfect. We're gonna kind of do that same thing here. So I have this that's going to cover both of your eyes, and there is kind of an opening, just little dots on one eye. And when you see the light, let me know, okay? So we're going to do 2 rounds. One light is going to be super, super bright, and then the other one is going to be kind of tinier. Okay, so we're going to be testing it here. Right, just covering this eye. Let me know when you see the red light. Good. Let's replace this one to the other eye now. Okay, let's begin. Good. Now we're going to be doing the same thing with a light. However, this one's going to be a bit different. It's going to have a beep sound with it. So sometimes when you hear the beep, you'll see the red light. Sometimes you won't. So you have to be very careful, okay? Right, covering your eye. Right, let me know when you see the red light. Yeah, it's very, very small and dull. Very good. Now let's do the other eye. Very good. That one was a bit challenging than the other one. It's a bit more challenging, so you did get one of them wrong, but that's totally okay. All right. Now, what I'm going to do is just test your sensitivity to air with your eyes. So I'm just going to open your eyes. I'm going to blow some air, so just try to relax. Good. Do it one more time. Very good. Other eye now. Try to relax. Good. Perfect. All right, we are all done with your eyes now. Now we're going to be just checking your hearing out. Let's see. So for a lot of this portion, I need you to have your eyes closed. Close your eyes. Okay, so I'm going to be making different sounds, and I want you to tell me what side you hear that sound. It's going to sound like that. So it's a little click. All right, so when you hear that sound, let me know what side you hear it on, left or right. All right, keep your eyes closed. Let's begin. beep sound, and I want you to tell me what side you hear the beep. Perfect. Okay. Now I'm going to be whispering some words in your ear, and I want you to tell me what word I'm saying. Okay? I'm gonna get closer. Okay. Dreams. Dreamy. Sleepy. Sleeping. Strawberry. Strawberries. Pineapple. Pineapple. Roses. Rose. Scratch. Scratching. Okay. Very, very good. So that was perfect. Okay. Now I have a tuning fork, and you are just going to tell me when the sound stops, okay? All right, let's begin. Very good. Let's do the other side. Perfect. All right. Now I'm going to be making this sound, so I want you to tell me when you hear that sound, okay? Let's begin. Perfect. Okay, I'm going to just touch your ears gently. Let me know if you feel any pain. Very good. Now I'm going to use this hammer. I'm going to press against your ear. I want to see the sensitivity of your ears. Okay. Any pain? Great. Let's do the other ear. Okay. Any pain? Perfect. Okay. So we are done with your yearly exam. You did fantastic. I didn't see anything that's concerning or anything to worry about. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening, okay? I'll see you around. Bye-bye.